Now, as the cost of Medicare in Nigeria goes up, the gap widens, making access to proper health care a challenge. Abimbola Agbebiyi looks at some of these ills facing Nigeria's health sector, a story triggered by a viral video of alleged nursing mothers sleeping on the corridor of a federal hospital.
November 2020, a video went viral.
I'd like to show you.
It was about an incident that happened at the Lagos University Teaching Hospital. The content painted a picture of mothers who were subjected to unfair treatment by management of the health facility.
I want this to go viral. The living condition of mothers who have babies, who have neonates in LUTH. This is where people sleep. Now they made available a lodge. The lodge is not good enough. The lodge is in terrible and poor state. And as of this morning, mothers were thrown out without prior notice, without anything. So we're going to post this. This is the reason why it looks like this is where people sleep.
Days later, TVZ News decided to visit the hospital, but with a hidden camera. Here is the famous corridor in the video. Indeed, there are people there, though a bit scanty. But are they truly mothers, like the viral video suggested? Most of them were not confident enough to speak, so I went to the hospital management. They claimed the video is a misrepresentation of the true situation.
She was with us for 22 days. She did not sleep there. Absolutely, she did not sleep on that. That's the corridor. The truth of the matter is that that corridor is not allocated to any mothers. That is a fact. The people that you see there, 90% of them are going to be relations. Quite many of these mothers, they don't really need to stay. They can go home and come back.
Moments later, I was taken to the facility where mothers are kept. Tiny rooms, barely comfortable for the occupants. It was clear that there are few available spaces for mothers waiting for their babies in the neonatal ward.
The rooms is not enough for the mothers. It's not enough. They will stay behind their children, because we saw some people, they want to come and rent a room. They said there's not enough bed. And precisely they will go and stay with their children. They will stay, they hang somewhere else.
With what we gathered, we were curious to know how the situation will be at night. It was 2 a.m. and what we discovered was talk. Occupants of the famous corridor fast asleep. Some slept in mosquito nets, while others were left in the cold. Though authorities of the hospital made us believe that the situation with the facility is a challenge of Nigerian hospital worth setting, which has no provision for family participation. Our research showed that most tertiary health facilities in Nigeria still have cases of patients sleeping on the bare floor.
There will never be enough bed space, okay, in Lagos, if we are still going to be running 2 teaching hospitals in Lagos. These hospitals have been there how many years? Population is increasing astronomically. And note, some referrals even come from outside even Lagos. So it means that the spaces would never be enough. It happened to me. We were in, I brought a patient and in a private car. We were in that car for 4 hours because there was no space. You understand? And this was someone who was very ill. Note, we are coming from another hospital where we were told that is the only place you can go to. And then you get to the teaching center and they tell you no space. If I can tell you it happened to me, imagine many other people that it may have happened to. I've heard of cases people who had to wait and eventually died in the car while waiting before they got attended to. So they are not false stories, they are not false claims.
For us to have patience during COVID at this time that infection is rife, for patients to be sleeping or for family members to be sleeping on the corridor. It is not a matter of now. I think it is wrong, and we should condemn it. And government or whoever is responsible for the management of hospitals should not try to cover up. They should not go into damage control that will not help us to solve the problem. You will see doctors about 5, there's no privacy, no patient doctor privacy, particularly at the teaching hospital. You have like a mini room with about 5 doctors, with students, medical students, trying to learn. You see patients, there's no privacy.
Officials of the Lagos University Teaching Hospital may have debunked the claims made in the viral video, but some Nigerians strongly believe there is need for a major overhaul of the Nigerian health sector, especially with issues like underfunding, poor infrastructure, and a comatose healthcare system, among others, facing the sector.
This past week, I have an ugly experience from a friend that lost a mom. The woman collapsed and she was rushed to the hospital. But unfortunately, on getting there, we were told that there was not enough bed space and that she was not admitted. Along the line, the woman had to give up. So it is quite a terrible experience.
The healthcare system in Nigeria is deplorable. There are no facilities in most of the hospitals. They are ill-equipped. And the human resources, they are very poor. They don't have adequate training. Some of them, they are very hostile even to their patients that they are supposed to care for. So when you look at healthcare system in Nigeria, you discover that the government have not done enough.
This is Nigeria's 2020 budget. Less than 5% of it was allocated to healthcare. The money is meant to cover LUTHs, yet so many hospitals are either understaffed or lack proper medical facilities. Back in 2001, Nigeria was one of the African countries that pledged to increase the annual health budget to 15%. For 19 consecutive years, it has failed to meet this target. The closest it has ever been was 6% in 2012, a far cry from the target. While underfunding is a challenge, handling the fund is another. What then is the way out?
It's unfortunate that millions, or I don't say billions, are being pumped, even though we say they are not adequate. But even the little, so-called little, that's really being pumped into this healthcare sector, you don't see the performance. Like, for instance, let me give you an example. The Aso Rock Clinic, yearly they pumping billions to Minto, but get there, it's almost empty. Our leaders don't use Aso Rock Clinic. I have an insider. Rarely do you see leaders using the Aso Rock Clinic because nothing is there, yet money is going in. So corruption has actually eaten very, very deep into our fabrics. That's the problem we have in Nigeria, and unless you really kill corruption, in fact corruption has almost killed Nigeria, it has even killed the health sector. This is very sad, very, very sad. Though I'm saying that you don't have enough budget, 3%, 4%, but even the 3%, you don't see the performance, because people just take in money into the budget and they share it amongst themselves.
With 40% of Nigerians living below the poverty line, access to proper health care will always be a challenge. Aside poor infrastructure, a lot needs to be done to strengthen the health care sector. Abimbola Agbebi, TVZ News, Lagos.